बेसिकली अगर हम देखेंगे तो ये नॉर्मल हिस्टोलॉजिकल इमेज है कौन से स्ट्रक्चर की, तुम्हारे स्किन की। ठीक है, सो दिस इज द नॉर्मल हिस्टोलॉजिकल स्ट्रक्चर ऑफ योर स्किन. आई होप ऑल ऑफ यू आर क्वाइट अवेयर हाउ मेनी लेयर्स आर देयर टू द स्किन. There are three layers to the skin. The outermost layer is known as epidermis. Then the second layer is known as dermis. And the third layer is known as hypodermis, also known as subcutis. ठीक है, तो डर्मिस बीच वाली लेयर है, उसके ऊपर जो भी होगा वो एपी, उसके नीचे जो भी होगा वो हाइपो. ठीक है, नो इश्यूज विद दैट एनीबॉडी. नाउ एपिडर्मिस की अगर हम बात करें, कितने लेयर्स एपिडर्मिस में? 5 लेयर्स होते हैं एपिडर्मिस में, स्टार्टिंग फ्रॉम द बेस टिल द टॉप. व्हाट इज द बेस? इट इज स्ट्रेटम बेसिल. फिर आता है स्ट्रेटम स्पाइनोसम, फिर आता है स्ट्रेटम ग्रैनुलोसम, फिर आता है स्ट्रेटम ल्यूसिडम, एंड फिर आता है स्ट्रेटम कॉर्नियम. आई होप ऑल ऑफ यू आर क्वाइट अवेयर दैट की स्ट्रेटम ल्यूसिडम हर जगह प्रेजेंट नहीं होता. स्ट्रेटम ल्यूसिडम इज अ ट्रांसपेरेंट लेयर ओनली प्रेजेंट इन palms and soles, and therefore the skin of the palms and soles is thicker as compared to the other parts of your skin. No issues with that anybody? That's important. Next, if I talk about the second layer, which makes the majority part of your skin, okay, or the epidermis. So what is that layer? Stratum spinosum. So the thickest layer of the epidermis is your stratum spinosum, which almost makes more than 1/3 part of your epidermis. Okay? And it is also known as which layer? Prickle cell layer. Prickle cell क्यों बोला जाता है? Because it has these hexagonal shape or polygonal shape keratinocytes. और keratinocytes को connect करने का काम कौन करता है? Desmosome. So usually in the stratum spinosum, we have keratinocytes which are connected with the help of these proteins known as desmosomes, and they look like spikes, and therefore it is known as the prickle cell layer. कोई दिक्कत नहीं है इसमें. Then we come to the stratum granulosum. नाम में ही उसके granula. That means it contains many granules. There are two types of granules in the stratum granulosum. एक होते हैं keratohyaline granules. One are keratohyaline granules, and second are lamellar granules. These lamellar granules are present inside bodies called as odd-land bodies. Very good. Okay, so these lamellar granules in the stratum granulosum are present in a specific bodies called as odd-land bodies. कोई दिक्कत नहीं है इसमें. So the question was previous year question: odd-land bodies are present in which layer of the epidermis? Now you know the answer. Odd-land bodies contain lamellar granules, and all types of granules are present in stratum granulosum. ठीक है, उसके ऊपर आती है कौन सी? Stratum lucidum. I told you stratum lucidum is transparent layer and it contains a specific type of granules. कौन से granules होते हैं stratum lucidum में? Anybody? ये नीट पीछे का प्रीवियस का क्वेश्चन है. एलिडीन granules are present usually in stratum lucidum. ठीक है, तो stratum lucidum में एलिडीन granules होते हैं और stratum granulosum में odd-land bodies होती है. ठीक है, so that's the basic difference between both of them. तो ये एलिडीन granules वाला आ जाए तो please remember granules. हाँ, definitely majority of the granules are present in granulosum only, but one specific type of granules called as elidine granules are present in stratum lucidum also. ठीक है, no issues with this. ये तो मैंने बता दिया. It is keratohyaline granules, and the second one lamellar granules known as odd-land bodies. ये important one-liners है guys, and questions have come from these earlier. ठीक है, so these are important one-liners. Then talking about the last layer, that is your stratum corneum. Stratum corneum contains which kind of cells? Columnar or flat cells? It contains flat cells. Nucleus होता है या नहीं होता? नहीं होता. So as we go from stratum basal to stratum corneum, what happens? This process is known as keratinization. तो keratinization में क्या होता है? जैसे हम stratum basal से लेके stratum corneum तक जाता है usually, as you can see over here. So these are the, this is the dermis, and then these are stratum basal. Here we can see there are columnar cells. Okay, then there is stratum spinosum, which is the thickest layer, as you can see, and it has these spikes over its surface due to the presence of desmosomes, and therefore known as prickle cell layer. Third is stratum granulosum, which contains multiple granules, one of them being the lamellar granules. Next is stratum lucidum, the transparent layer, and last one is the stratum corneum. So now what you have seen, what transformation you have seen in the shape of the cells. Now the shape of the cells from columnar, they have become more flatter. Apart from that, nucleus दिख रहा है क्या तुम्हें कहीं भी stratum corneum में? नहीं. In stratum corneum, the nucleus has been lost. This process is what is called as keratinization. When the cells will become more flatter, they will lose their nucleus, they will become more dehydrated. Dehydrated क्यों? Because they will lose a lot of water, and therefore these cells will become dehydrated, and these are actually the dead keratinocytes. ठीक है? And after some time, what will happen? They will stay over there in the stratum corneum for some time, and after that they will shed off. ठीक है? तो exfoliation जो बोलते हो ना तुम, that normally occurs in the skin, क्योंकि नए नए लेयर्स बनते रहते हैं, तो जो पुराने वाले हैं वो हटते रहते हैं. ठीक है? And that process is what is known as exfoliation, which occurs in the stratum corneum. ये जो टाइम लगता है स्ट्रेटम बेसेल से स्ट्रेटम कॉर्नियम तक जाने में, स्ट्रेटम बेसल से स्ट्रेटम कॉर्नियम तक जाने में, हाउ मच इज दिस टाइम एनीबॉडी? 28 days it takes. ठीक है? And this is known as which time? This is known as the epidermal transit time. ठीक है? epidermal transit time is around 28 days, whereas स्ट्रेटम कॉर्नियम में कितने दिन रहता है वो? In stratum corneum it stays for the next 28 days, making it a total of 56 days. तो बहुत क्लियर है, एपिडर्मल ट्रांजिट टाइम अगर पूछते हैं, इट इज 28 days only, because it is the time taken by the cells to reach from stratum basal to stratum corneum. बट एपिडर्मल टर्नओवर टाइम पूछेंगे. टर्नओवर मतलब पुरानी लेयर का जाना और नई लेयर का बनना, तो उस पूरे टाइम को कितना, पूरे टाइम में कितने डेज होंगे? 56 days होंगे, बिकॉज फॉर नेक्स्ट 28 days इट विल स्टे इन द स्ट्रेटम कॉर्नियम. ठीक है? कोई कंफ्यूजन नहीं है. लॉट ऑफ पीपल वर हैविंग कंफ्यूजन, सर हमें तो नोट्स में 28 लिखवाया है, बट बहुत सारे एमसीक्यूज में 56. This is the basic difference. Transit time, that the time taken for the transport is around 28, but it stays over there for the next 28 days, making the epidermal turnover time of 56 days. कोई दिक्कत नहीं यहाँ पे. That's the important thing. Nothing but modified macrophages of the skin which act as antigen presenting cells. कोई दिक्कत नहीं है इसमें. That's the important. And where are Langerhans cells present in which layer of the skin? Very good. Keratinocytes are present in every layer of the epidermis, but Langerhans cells, they are mainly present in the stratum spinosum generally. Okay, they are present in the stratum spinosum. So that was about your Langerhans cells. The next type of cells were called as your melanocytes. And melanocytes contain what? These melanocytes contain small vesicles filled with a pigment called as melanosome. ठीक है? एक बार So these melanocytes contain pigment-filled vesicles known as melanosomes. And these melanosomes are distributed to various keratinocytes. One melanocyte will give melanosomes to how many keratinocytes? 36 keratinocytes. Okay, so one melanocyte is equal to 36 keratinocytes for imparting color. This is what is called as the epidermal melanin unit. No issues with this, anybody? And this is to impart uniform skin color throughout your skin. ऐसा नहीं होना चाहिए कुछ जगह dark कुछ जगह light. ठीक है? So that's the basic funda. Melanocytes contain a pigment that is called as melanin. Okay, pheomelanin is produced in a fair skin, whereas eumelanin is produced in a darker skin. No issues with this. Number of melanocytes are equal in both, where a fair skin person or a darker skin person. The type of pigment which is produced is different. Pheomelanin, which is a yellow or a red color pigment, is produced in fairer skin, whereas a brown or a black color pigment known as eumelanin is produced in a darker skin. कोई दिक्कत नहीं, बाकी सब चीजें सेम रहती है. Melanocytes are derived from what? Melanocytes are derived from the neural crest cells, and these are migratory cells. Migratory matlab they are not present at the level of skin. Okay, they are produced by the neural crest cells and then they travel to the skin. Okay, so this is what is called as migration usually. Okay, so they are derived from the neural crest cells. That's the important feature which was a previous year question again. ठीक है, melanocytes का marker क्या होता है? They contain melanin. Marker क्या होता है? That's important. Where are they present? Melanocytes are present in the stratum basal. ठीक है, melanocytes are generally present in the stratum basal. And what are the markers for them? The markers for them will be S100. उसके अलावा HMB45. उसके अलावा melan A. ठीक है, so S100, HMB45 and melan A. These are the three important markers of melanocytes. ये important क्यों है? Because a cancer which arises from the melanocyte, what is that cancer called as? Cancer arising from melanocyte will be called as melanoma. So that malignant melanoma के लिए these can be used as tumor markers. समझ गए क्यों important है ये markers याद रखना? Because these are the same tumor markers used for malignant melanoma also. ठीक है, which is very important. Whereas for Langerhans cells, what are the markers? Anybody? S100 is a common marker for both of them. S100 के अलावा बाकी दूसरे markers कौन से होंगे? CD1A, and the most specific marker for Langerhans cells क्या हो सकता है? CD207. Very good. Okay, so the most specific marker for Langerhans cells is CD207, whereas the most specific marker for melanocytes is HMB45. No issues really anybody. So these are the important points. And the last type of skin cells that we need to remember. What are these last type of skin cells? These are known as the Merkel cells. And Merkel cells, also known as the Merkel disc, they are present in which layer again? They are again present in stratum basal. Please remember, they are present in stratum basal. And they are derived from what? They are derived from ectoderm. Very good. They are derived from ectoderm. And Merkel cells का काम क्या होता है? What is their function? Very good. They are actually touch receptors. Please remember. कैसे? Slowly adapting touch receptors होते हैं, having a low threshold. कोई दिक्कत नहीं है. आज तुम receptors पढ़ोगे physiology में definitely. No issues with this anybody? So that's the important thing. Okay, so these are the important 4 types of cells. अगर यहाँ पे देखो तो ये सबसे गुलाबी गुलाबी दिखने वाली लेयर कौन सी होगी? This is stratum corneum. अब यहाँ पे we cannot see any stratum lucidum because this is not a biopsy taken from the palms and soles. So stratum corneum के बाद ये जो दूसरी dark color blue color की लेयर है, क्यों? क्योंकि इसमें बहुत सारे ब्लू कलर के बेसोफिलिक, ब्लू मतलब बेसोफिलिक, ब्लू बेसोफिलिक कलर के ग्रैन्यूल्स दिख रहे हैं तुम्हें, इसीलिए दैट इज स्ट्रैटम ग्रैन्युलोसम. देन ये थिकेस्ट लेयर है जो बड़ी वाली, दिस इज व्हाट इज योर स्ट्रेटम स्पाइनोसम. और ये अलोंग दीज रिजेस दैट यू कैन सी, these cells, that is your stratum basal. So these are the 4 layers of the epidermis which can be seen. So this is your epidermis. Then the extensions of epidermis into the dermis, these are called as extensions of epidermis into the dermis are called as rete ridges. Please remember. Whereas iske niche kya aayega? Definitely this is your dermis. Now these dermis extends into the epidermis, and these dermal extensions into the epidermis, these will be called as dermal papillae. These will be called as dermal papillae, also known as the papillary dermis. Now dermis has 2 layers. I hope all of you are quite aware. The superficial 1/10 is made up of papillary dermis, these wala layer. But basically the 9/10 or the majority part of the dermis is made up of a reticular dermis. Important is papillary dermis में कौन सा type का tissue होता है? In papillary and reticular, right? Papillary dermis में we have loose connective tissue. याद रखना. In papillary dermis में we have loose connective tissue, whereas in reticular dermis, which kind of connective tissue is present? There will be a dense irregular connective tissue. ठीक है? There will be a dense irregular connective tissue in case of reticular dermis. And reticular dermis में क्या होगा? Reticular dermis में fibrils होंगे. Which fibrils are present in the skin? There are 2 types of fibrils in the skin. Anybody? 2 type के fibrils जो skin में present होते हैं. One which provide tensile strength to the skin. Stretchability भी देता है और tensile strength मतलब strength देता है skin को. That is collagen fibers. ठीक है? So one are called as the collagen fibers, which make up 70% of the dermis, and rest are your elastin fibers. ठीक है? Rest are your elastin fibers definitely. Collagen, कौन सा type का collagen skin में present होता है mainly? Most abundant collagen in skin is type 1 collagen. So bone, tendon, ligament, skin, usually it is type 1 collagen. Cartilage याद रखना है. तो मतलब cartilage में the most abundant collagen is collagen type 2. Okay? Collagen type 4 जो होता है वो important होता है again. That is present in the basement membrane. कोई दिक्कत नहीं है, तो at least ये 3 याद रख लो. Collagen type 1 is present in abundance in the skin, followed by collagen type 3. ठीक है? तो मोस्ट अबंडेंट अगर पूछा तो कोलाजन टाइप 1, बट अगर पूछा कितने कोलाजन होते हैं तो 2 होता है. कोलाजन टाइप 1 एज वेल एज कोलाजन टाइप 3 आर प्रेजेंट इन द स्किन. एंड लास्टली द थर्ड लेयर इज योर सबक्यूटस, आल्सो नोन एज योर hypodermis. This subcutis is made up of adipose tissue. ठीक है? फैट होता है उसमें, and that is what is called as panniculus also. So inflammation of that layer will be called as panniculitis. That was a previous year question. The question was panniculitis is inflammation of, and a lot of people were confused. So panniculus is another name for hypodermis. So panniculitis is inflammation of the hypodermis or the subcutaneous tissue, which is made up of adipose tissue or fat. कोई दिक्कत नहीं है इसमें. So these are the 3 important things that you need to remember. चलो. Moving further, option A, I told you already, the given structure is made up of stratified squamous epithelium. Yes, it is indeed. Option B says melanocytes in this structure are immigrant cells. Is it a true statement? I told you, right? Because melanocytes are not developed in the skin, they are developed by the neural crest cells, and then they have to migrate to the skin. So definitely they travel to the skin. Therefore, these are called as immigrant cells. वो skin में नहीं बनते, वो आते हैं travel करके. So option C says keratin filaments are the hallmark of most abundant cells in this structure. Definitely, filaments are present in what? Keratin filaments are present in the keratinocytes, and definitely keratin filaments are the hallmark feature of the keratinocytes. And keratinocytes, we know these are the most abundant cells seen in the structure. 90% of the skin is made up of keratinocytes itself. So 90% of cells are keratinocytes and their hallmark feature will be keratin filament. Okay? Keratinization is seen keratinization seen in the structure leads to hydration of cells. Now I told you keratinization में तीन चीजें होती है. एक, the cells will become more flatter. Second, they will lose their nucleus. And third most important thing, हाइड्रेट होते हैं, डिहाइड्रेट होते हैं, मॉइस्चर या वाटर लूज करते हैं, इसीलिए तो छोटे बन जाते हैं साइज में. सो देयर इज डिहाइड्रेशन ऑफ द सेल्स, नॉट हाइड्रेशन ओनली. देयरफॉर ऑप्शन डी इज अ रॉन्ग स्टेटमेंट. इट इज एन इनकरेक्ट स्टेटमेंट. दैट्स इंपॉर्टेंट थिंग. ठीक है. This is what is the epidermal melanin unit, one melanocyte imparting melanin to 36 keratinocytes. ठीक है. This is your Burbic granules. Burbic granules are present in which cells? Burbic granules are present in your antigen presenting cells of skin known as Langerhans cells. Okay. So these Burbic granules are which shaped on electron microscopy? These are tennis racket shape. That was again a previous year question. ये image भी आ चुकी है और ये पूछा भी जा चुका है. ठीक है. So Burbic granules which are tennis racket shape, these are present in the Langerhans cells. And where are Langerhans cells present? Stratum spinosum में. तो अगर देखा जाए तो granules तीनों लेयर में होता है. Stratum spinosum में in Langerhans cells we have Burbic granules. Stratum granulosum में मैंने बता दिया keratohyalin and lamellar granules are there. And in stratum lucidum I told you eledin granules are there. ठीक है. तो बस एक चीज मत याद रखना, pyrosebaceous unit है, मतलब याद रख लो. व्हाट इज दिस? दिस इज अ सेबेशियस ग्लैंड. और सेबेशियस ग्लैंड हमेशा अकेली ओपन होगी या हेयर फॉलिकल के साथ ओपन होती है? इट ऑलवेज ओपन्स अलोंग विद द हेयर follicle, as you can see, and therefore together it is called as a pilosebaceous unit. It never opens alone. Now when this will get blocked, there will be collection of all that sebum inside the sebaceous gland itself, and that causes inflammation known as acne, right? So blockage of the sebaceous duct or the hair follicle causes collection of sebum inside the gland, causing acne usually. ठीक है? So that's the basic one. Chalo, question number 2 now. If I talk about this, characteristic skin lesions seen in a disease causing multiple hematomatous polyps in the intestine are known as. What is your provisional diagnosis? Very good. Provisional diagnosis बराबर है, and that is what is Peutz-Jeghers syndrome. ठीक है? And Peutz-Jeghers syndrome, there are two important features. What two important feature? One is already mentioned in the question, the other is given in the image. So one, this, that is your multiple hematomatous polyps. And what is the most common site for this in the intestine? It is the jejunum. Okay, so there are multiple hematomatous polyps predominantly found in the jejunum of this patient, okay, usually. And the second feature is this. What is this? Usually you can see some hyperpigmented patches. Hyperpigmented matlab dark. ठीक है. तो here you are able to see some hyperpigmented patches, और small है इसलिए क्या बोल सकते हैं इनको? Macules. I hope all of you are quite aware. Flat lesions, if they are less than 1 centimeter, these are called as macules. If they are more than 1 centimeter, these are called as patches. Okay, so here definitely I can see multiple hyperpigmented macules, and these hyperpigmented macules, they are due to color. कौन देता है? Melanin देता है ना. So here you can see these hyperpigmented macules are due to increased activity of melanocytes. ठीक है. So please remember there is increased number of melanocytes. Okay, in certain areas there is increased number of melanocytes. The activity of melanocytes is normal. Okay, so the activity of melanocyte, because why I'm differentiating it, because there is another condition where ulta hota hai iske completely. ठीक है. Here there is increased number of melanocytes and the activity of the melanocyte is normal. Due to increased number of melanocytes, more melanin used in certain areas, which causes hyperpigmentation in certain areas, and this is what is called as perioral melanosis. इसीलिए this is known as perioral या mucosal melanosis, because these melanoses or hyperpigmented macules are not only seen on the lips but also in the oral or the buccal mucosa of this patient can be seen. ठीक है. तो याद रख लो. Now this is what is there. These hyperpigmented macules due to increased number of melanocytes associated with Peutz-Jeghers syndromes, these are also known as lentigens. These are also called as lentigens. No issues till anybody? Peutz-Jeghers syndrome, I hope all of you are quite aware. It is common in which age group? It is common in the adolescents, that is your teenage group. And what is the gene mutation? Only these are important points. Everything over here. It is STK11 gene mutation. ठीक है? So STK11 gene mutation causes Peutz-Jeghers syndrome in a patient. ठीक है? These hematomatous polyps, when they are alone, they are not pre-malignant. But when they are a part of some syndrome like Peutz-Jeghers, they will be pre-malignant and the patient will be at a higher risk to develop any colorectal cancer. ठीक है? तो याद रखना ये बात. Therefore, it becomes important. The other thing I told you na, increased number of melanocytes and activity is normal. That is lentigens. But on the other hand, if I say when there is increased activity of melanocytes, when there is increased activity of melanocytes, but the number is normal, okay, but number is normal, that condition will be called as, freckles or freckling. Okay, that will lead to freckles. These are also hyperpigmented macules. Okay, these are usually associated. These are the most characteristic feature of which neurocutaneous syndrome. Anybody? Freckling, freckles. Last time बताया था मैंने. Freckles are the most characteristic feature of which neurocutaneous syndrome. Axillary freckling and inguinal freckling are characteristic features of neurofibromatosis. Please remember, freckling is a very characteristic feature of neurofibromatosis. Common feature of neurofibromatosis is caveolé macules. But the characteristic of specific feature, if they ask you, answer is freckling then. Okay? No issues till anybody? That's the important thing. What are 46 spots, anybody? What are 46 spots? These are ectopic sebaceous glands. Very good. So please remember there are ectopic sebaceous glands, and most common site for these 46 spots or these ectopic sebaceous glands will be the, it is the lips usually. Okay? Okay, it will be the lips. So please remember 46 spots are definitely the ectopic sebaceous glands which are present usually on the lips. No issues with this, anybody? This was also a previous year question again. कोई दिक्कत नहीं है इसमें. So these are the important features, याद रखना जरूरी है. Now if I talk about the multiple skin lesions, तो सबसे पहले मैंने बोला था flat lesion अगर है, if the flat lesion is less than 1 centimeter, that will be called as a macule. ठीक है? Does not matter whether it is hyperpigmented or hypopigmented. That means whether or is a lesion less than 1 centimeter, it will be called as a macule. Okay? If it is more than 1 centimeter, then it is called as a patch. Okay? If it is more than 1 centimeter, as you can see, a flat lesion will be called as a patch. Then if I talk about a solid lesion, solid matlab, so if I talk about a solid lesion, definitely if it is less than 1 centimeter, it will be called as a, so less than 1, okay? So less than 1 centimeter will be called as a papule. When it is more than 1 centimeter, it is called as a plaque. So centimeter ka solid lesion is called as a papule. More than 1 centimeter ka solid lesion is called as a plaque. And when this lesion is more than 1 centimeter, along with that, it also has some depth. Along with that, it also has some depth. Then it will be called as a nodule. So solid lesion 1 centimeter, along with some depth to it, it will be called as a nodule. No issues till anybody? Then fluid-filled lesions, if I talk about. Fluid-containing lesions are called as blisters generally. If that blister is less than 1 centimeter, it will be called as a vesicle. If the blister is more than 1 centimeter, it is called as a bulla. No issues with this, anybody? So these are the important primary skin lesions that you need to remember. Okay? These are the important. And the last important primary skin lesions, if there is some pus containing lesions, if they are very small pinpoint lesions, then these will be called as pustules. So pus containing pinpoint lesions will be called as pustule. And when there is a huge lesion which contains pus, that will be called as an abscess. Huge collection of pus is what is called as an abscess. No issues with this, anybody? Apart from that, so these were usually your primary skin lesions. ठीक है? इसके अलावा क्या हो सकता है? Then there will be a wheal. ठीक है? Wheal is also known as, anybody? Hives. ठीक है? Yeah, they are seen in a condition called as urticaria, but the lesions are called as wheals or they are known as hives usually. ठीक है? So what are these? These are nothing but edematous skin lesions. Okay, due to some swelling, due to some edema in the skin, these lesions are formed for a short duration of time. These are called as hives or wheal. कोई दिक्कत नहीं है. So these are another primary lesions which can be seen. इसके अलावा जितने lesions दिख रहे हैं ना, all of them are secondary skin lesions. What do I mean by secondary skin lesions? मतलब there were some primary skin lesions जिसको तुमने कुछ कर लिया. एक तो तुमने स्क्रैच कर लिया itching की वजह से, और you have taken some treatment due to which these primary skin lesions have become some secondary skin lesions now. These secondary skin lesions can be what? It can be a scale. What is a scale? It is nothing but thickening of the skin usually. Okay, so here you are able to see normally skin exfoliates. What do I mean by exfoliation of skin? Desquamation of skin, या निकल जाती है स्किन, बट वो तुम्हें दिखती है क्या? नहीं दिख पाती, बट इन सर्टन कंडीशंस देयर इज विजिबल एक्सफोलिएशन ऑफ स्किन, जहां तुम्हें दिखेगी ये स्किन निकली हुई, दैट इज व्हाट इज स्केलिंग. समझ गए? नथिंग बट विजिबल एक्सफोलिएशन ऑफ स्किन यूजुअली. ठीक है. द नेक्स्ट secondary skin lesion is called as a crust. What is a crust? Now there was some lesion which was containing blood, pus or serum. Okay. Now this blood, pus or serum which is there, all this fluid, it gets dried up on the skin, and this dried up pus, serum or blood is what is called as a crust. So dried up pus, serum or blood is what is known as crust. No issues with this. Then there can be crack on the skin. If it is a linear crack, it is called as a fissure. Please remember. Then there can be multiple scratches on the skin, and multiple scratches on the skin due to itching is called as excoriation. Okay, it is called as excoriation. Then what will happen? The fluid filled lesion known as blisters, they will rupture, and when they will rupture, what will happen? There will be a loss of epidermis, and when there is loss of epidermis, that is what causes erosion. This was the question. Okay, so erosion is due to what? Erosion is due to loss of epidermis. Please remember, guys. Okay, and it is formed in which skin lesion? Usually there were vesicles or bullae primarily, and now when they have ruptured, then there is formation of a erosion. Then lichenification. Lichenification kaha pada hoga? Papillosquamous diseases. What are two important examples of papillosquamous diseases? Anybody? Psoriasis and lichen planus. In both these conditions, you will be able to see lichenification. And third important is atopic dermatitis. You in all these conditions, there is a lot of itching. As there is a lot of itching, tum itching karte rahoge. If there is chronic itching, it will land up in lichenification. What happens in lichenification? There is usually thickening of the skin which is seen. Second feature, there is hyperpigmentation of the skin. That means the skin in that specific part becomes darker in color. And last one, there will be exaggerated skin markings. These three things together is what is called as lichenification of skin, which are usually seen in itching disorders. Okay? And last one is a scar. कोई दिक्कत नहीं है. So these are the important things, guys. These are primary and secondary skin lesions, which you can find. Again, this is a snapshot from the same FMG snaps itself. Chalo. Moving further now, talking about question number 3. It says a male patient presented to the OPD with characteristic lesions as shown in the image on the interdigital clefts. What are the interdigital clefts? These web spaces between the fingers. Okay, these are known as the interdigital clefts. So at these interdigital clefts, you're able to see these characteristic skin lesions. Okay, and these skin lesions were also present on the penis of the patient. And what was the main complaint of the patient? Excessive itching. Excessive itching is also known as pruritus. So they can mention pruritus also. The patient had a previous history of steroid intake for the same symptoms as prescribed by a local practitioner. What is your provisional diagnosis? Anybody? Pehle to. So interdigital clefts or these web spaces are the most common site for a disease called as scabies. It is a parasitic infestation or parasitic infection caused by a mite called as Sarcoptes scabies. Okay, so Sarcoptes scabies is nothing but a female mite which causes this disease known as scabies. So yes, scabies है, ये सबको पता चल गया, because the most common site is definitely the interdigital cleft of the web spaces. Most common symptom is itching. The other common site will definitely be the genitalia, mainly the penis. Okay, and the patient will have excessive itching, and therefore scabies is also known as which disease? Scabies is also known as which disease? Anybody? It is called as a 7-year itch disease, because here the patient feels like this itching is a never-ending itch. Therefore, it is called as a 7-year itch disease or a Prince itch disease as well. Okay? So that's the important thing. You will find this patient always scratching somewhere due to the itching that occurs. No issues with this, anybody? Now, do we, like all of us know, what is the drug of choice for scabies? Anybody? Drug of choice for scabies is definitely local application or topical application of ointment or cream known as 5% permethrin. Right? The drug of choice is definitely 5% permethrin. But यहाँ पे local practitioner ने क्या दे दिया इसको? Steroids. Do we give steroids? No, steroids are not given. They have no role in cases of scabies management. But steroid was given. What happened due to steroid? The infection khatam hua kya? No, the infection did not go. Rather, what happened? The infection went into a dormant state. What do I mean by dormant? Inactive state. That means the female mite went into an inactive state or a dormant state for some time, and again वापस से क्या हो गया? Reactivation हो गया. ठीक है, जब उसको मौका मिला, जब उसको चांस मिला, वो reactivate हो गई. ठीक है, dormant I hope सबने मोबाइल यूज करे, सबको पता है, जब dormant या inactive फॉर्म में जाते हो, that is what is called as incognito. ठीक है, so that is what is known as incognito. So here, due to steroid intake, if the scabies region, they become inactive for some time, and again there is appearance of more severe symptoms, that is what is called as a scabies incognito, and it is due to intake of steroids in a case of scabies. Okay, so that is scabies incognito. So the most likely diagnosis in this is option number B, that is scabies incognito, because drug of choice for scabies is 5% permethrin. As local steroids were given, the infection went into a dormant or an inactive state. That is what is incognito. कोई दिक्कत नहीं है. What is Norwegian scabies? Anybody? Very good. So please remember, Norwegian scabies is the most severe form of scabies where the patient will have poorest prognosis. Okay, and it is usually seen in severe form. किसमें दिखेगा? Only immunocompromised patient. So definitely Norwegian scabies is generally seen in immunocompromised patient like HIV positive patients, elderly patients. ठीक है? In all these patients, you will be able to find Norwegian scabies. So what is the most characteristic lesion of scabies? Anybody? These are special type of lesions which are seen. What is the most characteristic lesion of scabies? All these female mites go into the skin. They go into the stratum corneum and they form a tunnel. What is that tunnel called as? Very good. That is called as a burrow. Please remember. Okay. So the most characteristic lesions of scabies are definitely known as burrows usually. Okay. So usually burrows are seen in a case of scabies, but in cases of Norwegian scabies, we'll be able to see a lot of crusting on the skin. Okay. As you can see over here, this is what is the case of Norwegian scabies where there's a lot of crusting which is seen. Okay, so this is what is the crusting. Okay, these are the burrows which are the most characteristic lesion of the scabies. You can see these mites are traveling under the skin, beneath the skin, forming a tunnel called as the burrows. Okay, and usually when the itching will be more